Hi, very good evening. Today we discuss about vaccination in animals. So vaccination is one of the important in animal husbandry. What is vaccination? Vaccination is the process of administering treated microorganism to develop immunity against disease. Stages of vaccines production, where we concentrate first and foremost antigen preparation, followed purification to remove the unwanted debris, followed inactivation and formulation, then filling, then batch release, finally packing and shipping. There are different methods for antigen inactivation. The first and foremost is heat inactivation. Heat is widely used method to inactivate virus, bacteria, or even any other moiety that we are trying to use as a antigen. Through chemical treatment, where we can use chemical agents like detergents, fixatives, and denaturants, which will also effectively inactivate virus and other microorganisms that we are using for antigen preparation. The third method is ultraviolet light. So UV light damages or targets genetic material of that organism, inhibiting replication or rendering that microorganism to become non-infectious, which is commonly used for inactivation in laboratories. Ingredients of vaccines. Though we go for animal veterinary hospital, where the moment we request the veterinarian related to vaccination, so he will bring a vial which will have ingredients like this, because it is not readily prepared and vaccinated to animal. So which is prepared, as we discussed in the previous slide, which is prepared and kept it in a freezing condition, where if the necessary arise, they thaw it and which will be used. So during preservation or during storage, so those vaccine need to get remain effective in nature without losing its property. Hence we need to add preservatives, stabilizers, surfactants, diluents and adjuvants. So without which we cannot store vaccines for prolonged period. Coming to types of vaccines. So there are different types of vaccines available in the market for treating small ruminants as well as large ruminants. So the first and foremost is attenuated vaccine. So some vaccines contain live but altered microorganism. Many of these are active viruses or active microorganisms which is cultivated under condition that desirable their virulent properties. Attenuated vaccines have some advantages and disadvantages. Attenuated vaccine typically provoke more durable immunological response when compared to other type of vaccines, but they may not be safe for use in immunocompromised individual animals. Second one is inactivated vaccine. Some vaccine contain inactivated but previously virulent microorganisms that have been destroyed with chemicals, heat or radiation. They are considered an intermediate phase between inactivated and attenuated vaccines. The third one is toxoid vaccines. So this is a special vaccine where toxoids are made from inactivated toxic compound that is produced by microorganisms. When activated, cause damage to cells. Examples of toxoid based vaccine includes tetanus and clostridium. Not all toxoids are produced as toxins which is created by microorganisms. So that differ based on their survival nature or environment. Subunit vaccine. So the name implies where we collect a different subunit from different part, which can be connected in such a way to remain the property to induce or to provoke immunity in the target organism, where these vaccine contain short specific protein that are same as the antigen of target pathogen. A subunit vaccine uses a component to induce an immune response rather than introducing a whole inactivated or attenuated microorganism into an immune system. The next one is conjugate vaccine. Certain bacteria have a polysaccharides, which is outermost layer, which is a weak antigen. The immune system has a more robust response by linking these outer coats to proteins like toxins, where we are conjugating two different entities. One is surface moiety of bacteria, the other one is toxin produced by another bacteria. So which combining these two entities, which gives best result or which provoke effectively the immune response in the target animals, which claim that as a strong antigen. Vaccines for cattle. There are different commercially available vaccines for both large ruminants as well as small ruminant. So the first one is anthrax spore vaccine. So anthrax is a zoonotic disease caused by spore forming bacteria called Bacillus anthracis. So this disease can be controlled largely by annual vaccination. Anthrax spore vaccine is preferred from non-pathogenic and non-capsulated variant strain Bacillus anthracis. So this vaccine is recommended doses 1 ml, which is injected subcutaneously, or the region locating the neck just in front of the shoulder is a convenient site for administering this vaccine to the small ruminant as well as large ruminant. Revaccination in 2 to 3 weeks in heavily contaminated area is recommended. Black quarter vaccine. So it is generalized infection of cattle caused by Clostridium chowai. The general symptoms are complete anorexia, marked prostration, muscular tremor, congested mucosa, dysphonia, rapid pulse and high fever. This vaccine is suspension of formalin-killed Clostridium chowai culture adjuvanted with aluminum hydroxide gel. First vaccination is done at the age of 6 months and is then repeated annually for that particular cattle. Hemorrhagic septicemia vaccine is mainly caused by bacterium Pasteurella multicida, affects both cattle and buffalo. The worst epidemic occurs during this rainy season in animals in poor physical conditions, which is characterized by an acute, highly fatal septicemia with high morbidity and mortality. So this vaccine is available as formalin inactivated culture of Pasteurella multicida with a aluminum hydroxide gel precipitated vaccine. First vaccination is done between 4 to 6 months of age and then repeated annually at least 15 to 20 days prior monsoon. Vaccination has led to decrease in disease outbreak in many countries. Brucella abortus strain vaccine is a main causative agent is brucellosis in cattle, causing abortion and infertility in adult animals. So it is a live attenuated vaccine and the first vaccine to be used extensively for bovine brucellosis control. This virulent culture was accidentally left out at room temperature for 1 year and when tested in guinea pigs showed lower virulence compared with previous tests. Subsequently, this strain showed be a highly successful in immunization of calves. Female calves between 4 to 8 months of age are vaccinated once in lifetime. Foot and mouth disease is another important vaccine. So this vaccine is one of the most contagious transboundary animal disease in the world, caused by FMD virus. FMD caused huge economic loss in India as well as across the world, and vaccination with inactivated trivalent vaccine twice in a year is followed to control this disease effectively. The virus antigen grown in BHK21 suspension cells is inactivated with formaldehyde, absorbed an aluminum hydroxide, and saponin is used as an adjuvant. The vaccine has contributed significantly in reducing the incidence of FMD in most of the countries. Buffalo pox vaccine. Buffalo pox is an infectious disease caused by buffalo pox virus, an orthopox virus of the family Poxviridae. It causes both localized and generalized infections of buffaloes, cattle, and also humans as a zoonotic agent. Buffalo pox is associated with productivity loss in terms of meat, milk, and draught capacity of an animal. A live attenuated vaccine has been developed by using an indigenous isolate. The vaccine was developed by attenuating the virus in vero cells and has been tested for safety, efficacy, and potency in buffalo calves. Vaccines for sheep and goat. Sheep pox vaccine, it's a type of live attenuated vaccine. Sheep pox is an infectious disease of sheep caused by sheep pox virus. This disease is endemic in India and causes substantial losses. It is a cell culture based live attenuated freeze-dried vaccine prepared from sheep pox virus. The dose of vaccine is 0.1 ml for all age groups and is given intradermal in the caudal fold of tip of the ear. The vaccine confers immunity for more than 1 year. Enteroxemia vaccine is also called pulpy kidney disease, is caused by Clostridium perfringens type D in sheep as well as goat. The classical enteroxemia of a sheep is seen less frequently in goat, rarely in cattle. The formalin inactivated culture of Clostridium perfringens type D and epsilon toxide vaccine is produced by adjuvanted with aluminum hydroxide gel. In lambs, first vaccination is done at the age of 4 months. After primary vaccination, vaccine should be repeated annually before monsoon positively. PPR vaccine is another live attenuated vaccine. It is an important viral disease of sheep and goat causing huge losses in India and abroad. Control of PPR is usually done by vaccination of animals with live attenuated vaccine at more than 3 months of age. The vaccine developed usually vero cell based live attenuated indigenous PPR vaccine. The recommended dose of vaccine is 1 ml to be inoculated by subcutaneous route in the neck region. The freeze-dried PPR vaccine has a shelf life of 1 year at 4 degrees Celsius and reconstituted using 1 molar magnesium sulfate. Vaccine should be used within 8 hours after reconstitution. Goat pox vaccine. Goat pox is highly contagious viral disease in goat. Live attenuated vaccine is produced using Uttarkashi isolate of a goat pox virus in vero cells. The vaccine is safe, potent, and efficacious, providing immunity for at least 40 months and possibly lifelong. Vaccine supplied in lyophilized condition can tolerate ambient temperature condition without loss of titers. The vaccine has potential use in endemic regions not only in India but also in other affected regions including Southwest, Middle East, and Central Asia and Northern and Central Africa. Blue tongue vaccine is a non-contagious arboviral disease caused by a double-stranded RNA virus belonging to the genus Arbovirus and family Rheoviridae, affecting domestic and wild ruminants. Southern states like Tamil Nadu, Andhra Pradesh, Telangana, Karnataka are mostly affected by this disease. India's first multivalent inactivated pentavalent blue tongue vaccine containing most prevalent serotypes like 1, 2, 10, 16, 23 was developed. Time of vaccination is first at the age of 4 months and boosted after 28 days of first vaccination. Recommended dose is 2 ml of vaccine is injected subcutaneously. Vaccines for poultry. Ranicate disease vaccine. Ranicate disease is otherwise called Newcastle disease. It is highly contagious and most lethal viral disease of poultry. These vaccines are freeze-dried suspension of modified live virus produced in embryonated chicken eggs. These freeze-dried vaccines can be stored at -15 to -20 degree and transportation should be done in the 2 to 6 degrees Celsius. Ranicate disease vaccine is a live vaccine and administered by intranasal, intraocular, drinking water or spray administration in between 1 to 5 days old chicks. The next vaccine is fowlpox disease vaccine. It is a disease of poultry and other bird caused by double-stranded DNA virus of genus Poxvirus of family Poxviridae. This disease causes economic losses due to transient drop in eggs production and a reduced growth rate in young birds. Vaccination at proper age with dependable vaccine is most effective means of controlling fowlpox. Chickens are vaccinated with attenuated fowlpox virus based vaccine at the age of 12 and 16 weeks through the wing whip method of injection. Thank you very much for watching video. We will meet in the next video.